Hi, my name is Sarah with the Arizona Daily Star. I'm the opinion coordinator, and I am joined by Sarah Garrett Gasson, the editor of the opinion pages at the Arizona Daily Star. Welcome, Sarah.
Thank you.
So today our special guest is Melissa Maize. She works as a case manager for Banner University Health Plan. And before that, she worked at Keyberry, which is a nursing facility in Benson. So we'll be able to talk to her about some great things today. So welcome. So glad to have you here. And we are also joined by Jason Barham, who also is Melissa's manager. So feel free to chime in, Jason, if you have anything further to contribute to the conversation. But Mel, why don't you go? I call you Mel, I'm sorry, but
that's
Melissa.
okay. No, a lot of people do. Yeah. That's just because you know me a while.
Yeah. So yeah, go ahead and introduce yourself. Talk a little bit about your time at Keyberry, also about being a case manager, and then we'll kind of jump in if we've got some questions along the way to keep it going.
Okay. So I got my bachelor's in human services and management 10 years ago. I had no idea what I wanted to do when I got it. I just knew that I wanted to help people. So I just kind of lucked into the position at Keyberry. It's actually Good Samaritan Society Keyberry Mission. It's the nursing home here in Benson. The same weekend, I think I graduated, I started Keyberry the following Monday. So I did a lot of cool stuff at Keyberry, and I worked there for 5 years. I was social services director, staff development director, quality assurance director, marketing director, resource development director, and activities director. And I started out as activity assistant there.
Wow, so that was a lot of shoes to fill.
Yeah. And so I basically did, some of the positions I did simultaneously, like the resource development was my favorite one. That was the fundraising and it was kind of marketing too, but fundraising and writing grants. So in my time there, I was able to write a grant for music therapy after watching a movie called Alive Inside. I don't know if anyone's seen it, but it's about how music triggers memories for folks with dementia. So I wrote a grant and I got them $75,000 towards that program.
Wow.
So it was a really, really neat thing to do. It was really neat to watch the folks with dementia just come alive with the music that they grew up with, or, from when they were 18 or 20. And, they would listen to it and you could just see them really honestly come alive and start talking about things that happened to them at that age. So that was really fun.
Just out of curiosity on that, Melissa, when that music therapy, they become more cognizant, but Absolutely. From that age of that era, or do they just become more aware even of their current age?
Both. Yeah, both. They would start talking about things, that they had done when they were that age, and it just seemed to help with their memories all around. It seems unbelievable, but I watched it happen. So it was just an incredible thing. There was a lady at the facility. She actually was on Broadway, and we didn't realize that until like after we brought the music therapy and she started talking about things that she had done on Broadway. And when I Googled it, we actually found that she was one of the first Broadway singers. It was kind of neat. And then let's see, I wrote a grant for this was when I was leaving. I was actually in the process of writing a grant, and then they got it as I was leaving, but it was for a community greenhouse. So I had partnered up with the Benson Food Bank, and they got a refrigerator truck out of it. And the Chamber of Commerce, they were going to start a farmer's market, but I guess they didn't have the resources after I left to finish the project. So they gave the greenhouse money back, but that would have been really a neat project too. We were going to have the high school kids volunteer to help with the folks in the greenhouse, but that one didn't work out just because they didn't have enough staff. Nursing homes are usually pretty short staffed. Let's see, I had a couple of murals painted when I was there. The big mural on the outside of the building. That was my idea, and I raised half of the money for that. and the other half of the money got raised after I left.
Was that
And then
painted by, is it Doug?
Doug Corals, yeah.
Yeah, Corals. And
Yep.
he paints a lot of murals around town in Benson. I don't know if any of you have ever gone down to Benson. It's well worth a trip down there. He has a gallery. I can't remember what his gallery is called on Main Street. And he has a book that will take you on a tour of his murals. And it's really fascinating to see because he always hides something out of the ordinary in his murals. And so like it's a desert scene and he'll put like a UFO alien or so, just something quirky, but his work is amazing.
The mural of the Karcher Caverns, there's a picture of him painting a picture of him. So there's like 3 of him in the picture. Yeah. And then the one at the Frontier Fitness, that one he's working on right now. And that one's incredible because he's got the American flag behind it. And then he's got different servicemen. And then all of the people that are standing for the Pledge of Allegiance, they're all people from Benson.
That's another thing he does in his work. He uses faces. So, somebody that works at the visitor center that everybody knows, Bob, he puts him in, and like on not a chariot, what's the word I'm looking for?
Stagecoach.
Stagecoach. Thank you.
Yeah.
Kind of neat. Oh, that's amazing. So you guys got one out there at Keyberry as well.
Yeah. Actually, there was 2 at Keyberry. There was another one that I had done in the special care unit. The folks with dementia would just sit in the living room and not really have a whole lot to do. So I had him put a mural of the ocean, and it just covered the whole wall. And they would just sit and admire it and talk about it. And that was my favorite thing. Yeah.
That's wonderful. So let's talk a little bit. We can come back to Keyberry, but let's talk a little bit about what being a case manager is. And then also, like, how was your job affected by the pandemic?
Right now, we are not most of the nursing homes, I think actually all the nursing homes are not allowing visitors in. So we're doing everything by video chat, by telehealth. I'm not sure. I think we should be going back out pretty soon. But so everything's been done by phone for a little while. And I know our members miss us. They get very attached to us, pretty much every time we talk to them. Well, when are you coming back out? So
talk a little bit more about what is a case manager? What is your job?
Okay, so Banner is actually contracted with Altex. That's Arizona Long-Term Care. We serve the 8 counties, which is Cochise, Graham, Greenlee, Yuma, Santa Cruz, Pima, Pinal, and Maricopa. I believe there's around 100 or so case managers. There's 12 of us for Cochise, Graham, and Greenlee. And then we have 1 manager, and then we have 1 RN on our team, and we have 1 behavioral specialist on our team. So we have a lot of support for anything that we need. And let's see, some of us have nursing facilities. I have a nursing facility, and then I also have some people that live at home. There are home-based people. After the members have gone through the whole Altex process and they've qualified for that, then they come to us. We have an area.
I'm sorry, what Altex is?
Altex is Arizona Long-Term Care. So it's Medicaid. Some people have Medicare, some have Medicare and Medicaid. So it's a state program.
And how do you qualify for that? Is that something that you sign up for? Is that something that is done?
Jason, do you want to answer this one?
Sure. So anybody who's on the what's considered the ambulatory access plan, and if they become so sick or if they require so much help with items in the home, then they can fill out for the long-term care program. And the best way to do that is by going to the local DES office, calling Access, or going to the Access website, because Access, of course, is the gatekeeper for anybody coming on to their plans, and they have eligibility specialists which help determine whether or not somebody will actually qualify or not.
And access is Arizona Health Cost Containment System.
Yes, ma'am.
So after they've gone through that process, they will be assigned to one of us case managers, and we have a kind of a set area that we cover so that we're not driving too far, because Cochise County is a big county. Some of the girls that live out in the Graham and Greenlee area, they have to travel quite a bit to see some of their members. So they try to keep everybody in the same area with a case manager. If a member lives at home, we assist them with home delivered meals, emergency alerts, or a caregiver. Sometimes their family can be their caregiver if that's what they prefer. So we help the family go through the training to get hired on to one of the agencies. We check on our people that live at home about every 3 months. People in the nursing homes, we check on them every 6 months. We assess the level of care for the people at the nursing home, and then we do the authorizations that pay the nursing home for their care, and same with the agencies with the people at home. And that's pretty much it. We pretty much will follow them if they go, say they live at home and then they have to go to the nursing home for rehab. We would follow them, make sure that everything's taken care of. And then when they get back home, we would make sure that their services are back in place when they go home. If they go to a nursing facility permanently, we usually transfer to the case manager for that building. We try to keep one case manager per building.
So ultimately, I mean, just to clarify if I'm understanding this right, as a case manager, your job is to assess what needs they have and then making sure that that care happens, or am I understanding that right?
Yes, we pretty much oversee their care.
Okay.
So, yeah.
I mean, oh, go ahead, Sarah.
Well, maybe we're asking the same question. Like if this was me and I had to go into a nursing home for a rehab or whatever, will I know you individually, or do you work at the level above the patient?
No, we will know them individually. Yep. We're very close to our members. They get very attached to us. We would become their family,
And then when the person is ready to go back home, or is there ever an ending to the relationship?
If the person were to go into a different facility, say they went from Keyberry to a facility in Phoenix, then we would transfer to the case manager for that building. In those cases, if the drive is too far, we would. And it's nice for the nursing homes to have one case manager that they call for different things versus a lot of different ones, and they don't know who to call.
Right. Yeah.
So I see in the chat that June was asking, can you maybe talk a little bit about any of the eligibility requirements for Altex?
No, I don't have anything to do with them until they get on my caseload. Yeah.
Okay, so that would be DES that they would, get that, and they would qualify through DES for
Right.
Altex, and then Altex, transfers the care to you guys.
Yeah. Once they become on the Banner University Health Plan, then we would help them, but not until then.
Okay. So I'm sure that, you still have a lot of friends that work at Keyberry, after, living in the town and,
Right.
working there for a time. Can you talk about, how was Keyberry hit with the pandemic? I mean, so many of our nursing homes, it was just such a scary time, for those residents, just because the atmosphere, it's just going to happen. And how have they been weathering the pandemic?
I'm not sure. I don't know. And because of HIPAA, we're not really allowed to talk about anything like that.
Yeah.
But I know that all of the nursing homes they've done really well. It's been kind of sad for some of the members because they weren't able to see their families, but I think they're all pretty much opening back up now. And if a member requests us, we are allowed to go see them now. So Because I think that was the hardest part for people is that personal, attention.
Yeah, I think all of us in every aspect of our
Definitely
life,
gotten more phone calls from members than usual.
really. So they're able to as a case manager, just if they feel that they have a need, they can reach out to you,
Yes,
whenever,
yeah,
regardless
our
of
members
the.
call us all the time. Yeah, I've had members call me and my dryer's broke or things like that.
Are
Yeah.
those things you can handle?
No, no, I would certainly give it a shot, but
But can you, are you, how are you different than a social worker who might be able to say, oh, you should apply for this, dryer fix it program?
well, I think that, most of us case managers, if something like a dryer, we would reach out to people and try to help them, but it's not in our job description.
And could you explain a bit about the difference between what a social worker might do and what your job is?
I think it's pretty much the same. I've been a social worker. I was social services director at Keyberry. We did pretty much just the same thing.
Are there any patterns, that you've noticed? Of course, the isolation, has really been affecting them, but, just any, different things during the pandemic that have just kind of, that you've noticed happening with, do you call them your patients or?
Members.
Okay, members, just, anything out of the ordinary or?
No, I'm pretty lucky that I have a facility. I have Life Care Center in Sierra Vista, so most of my members are there. I don't have too many home-based people, but all of their needs are met at the nursing home. And my home-based people, they definitely call me more just to chat. But that's really the only difference I've noticed.
And who makes the decision between if you're going to be home-based or go into a facility?
The member, always the member. They have a right to live where they want to live, and our goal is always to keep them at home as long as possible. So we go in and we get them as much help as we can, and then when they're no longer able to live at home safely, then they usually make the decision to go into a nursing home, them with their families.
Yeah, Diane.
Unmute, yes. I wondered if you do any work or make referrals for people who are family members of the members of Alltech.
To qualify for Alltechs?
No, to when they are in care. Family members have some issues that they may need help for. Can you provide any assistance for that? Or can you make referrals for that assistance?
We only focus on the member, but like I said, with a regular social worker, there's always situations where you're going to go above and beyond and do what you need to do for the family as well.
Thank you.
Probably a hard line to draw,
Always, yeah.
Just knowing you, I know you're full of compassion and you're a fixer and, so it's like you get close to these people and you have that compassion, and yet sometimes you almost have to reserve yourself because,
Yeah. When I worked at Keyberry, there was a lot of my family having to go help other people. They were kind of relieved when I left Keyberry for that reason.
Well, that's one of the things of a small town too,
Right, yeah.
Everybody knows you, they know where you live, they know who your family is. So they're like, hey, that's convenient for you. I know.
Right. Yeah. My husband and kids used to joke and say they worked at Keyberry too.
Yeah. Well, I think in some ways, all of us, our families, they hear about our job enough and,
Right.
that they are, part-time employees in essence.
Yep.
So what kind of motivated, I know you said that you were, looking to just help people, so when you decided to go back to school and to kind of, just kind of what Can you?
I
speak to,
wasn't
like,
sure at all. I had no clue what I wanted to do. And then when I started at Keyberry, I love they call them residents there. I love them. And that's where I knew I wanted to be. And then I remember when I worked at Keyberry, the case manager, it was Bridgeway then, the Bridgeway case manager had come into the building, and I looked at her and I was just in awe with what she was doing for the members. And so I pulled her aside and I said, what do you do? You know, and I wanted to work there. That was my goal. And so I applied. She let me know when a position opened up, and I applied. I didn't get it the first time around, but then a couple of years later, they called me and I got it the second time. So I just knew that this is where I wanted to work, you know.
And then how did the transition really happen from, you know, Keyberry to case management?
There was a lot of training. At that point, we were Bridgeway. When I first started with Bridgeway, we actually would go, because we work from home. So we would go to an office. I went to an office every day for 3 months before they released me, you know, to work from home. So it was nice to have, I had somebody that was my mentor, and she was there in the office with me for 3 months to answer any questions that I had. And she was just wonderful. And so, you know, we've stayed really close. We call each other pretty much weekly now. But it was a lot of learning, but it was an easy job as far as the people, you know.
So what kind of training is there for, I mean, of course you had your schooling, but what kind of specific training for a case manager is there? I mean, because like, do you need to have knowledge to, like, when you have a patient and you see, wow, they really need some rehab, whether it's occupational or physical or whatever. I mean, how do you all of a sudden, you know, do you get training?
Yeah, I think the nursing home really helped me with all of that stuff, you know, and that's probably why I got a nursing home. But that stuff I learned at Keyberry, and it's really helped me, you know. And I think when you first become a case manager, there's so much, because you know, every case is different, and there's so many different things that you have to learn. So it really takes a couple of years to figure it out, you know. And even now, I mean, 5 years later, actually, I got the job 5 years ago tomorrow, because tomorrow is my birthday.
Oh.
So yeah. So even, you know, 5 years later, and I'm still learning this job.
So from a planning perspective, how do you have advice for people on, you know, who might be here or watching this later about, and generally speaking, since I know you can't, you know, speak about specific situations necessarily, but how can one plan for this phase of your life?
I'm not really sure. I don't know what the qualifications are for all techs or any, you know, like I said,
I guess I just mean more broadly speaking, what are the, you know, like housing, medical, as you look at you know, your life, and you're doing sort of, what are the things that you need to kind of pay attention to that we might not necessarily think of?
I'm not sure how to answer that one. Jason, would you be able to answer that?
Yeah, I can take a whack at that. A lot of folks don't think. Yeah, a lot of folks, that's an excellent question. A lot of folks don't really think about, what am I going to have to do once I'm at a stage in my life where I'm a little more vulnerable, or I'm more dependent on others. It's something that we just don't think about. I think one of the most important items, the single most important item that somebody can do before it's too late, is to fill out advance directives and power of attorney paperwork. Because once you're diagnosed with some sort of a diagnosis indicating a cognitive deficit, well, then it's too late to do that power of attorney documentation now, and it becomes a barrier. So that would be one item that immediately comes to mind.
Thank you. Thank you.
Do you ever deal with situations, you mentioned, you know, like where family can say that they want to become the caretaker, and so you help them qualify for that? But is part of your job, when you go into the home, kind of assessing their home life? Like, so let's say you go into a home and it's just not a great atmosphere for, whether they're not getting the care that they need from, let's say, maybe a family member, or maybe you feel they've advanced to a point where they need, a long-term care facility. I mean, how do those kind of situations work? Does that fall under your jurisdiction?
Definitely. Yeah. We deal with that a lot. Especially in the like Cochise County and Greenlee County, it's such a rural area that it's hard to find caregivers that are willing to travel, to members' homes. Some of these guys live way out in the middle of nowhere where there's no hospital around, there's no resources for them. So we do, a lot of family members prefer to be the caregiver, and that helps us as well. When they go through the training with the agencies, a lot of people prefer to have their family take care of them. Why wouldn't you? So if the family is able to stay at home and get paid to be there for them, then that's even better. And there are some homes that are not quite safe, but I mean, they have a right to live at home however they've been living, as long as they can.
So, but I guess I wonder, because technically they're qualifying through, DES and then Altex and then to you guys. Technically, it's kind of like a state-run thing that you're qualifying for. So I would imagine that there would be some standard of care, so yes, people have their own decision, but if you're going in a home and, you're seeing, a person being unclean on themselves,
Right.
or, I mean, it's just like, so do you like talk to the family about fixing that, or does that get sent elsewhere, or how do those kind of
Yeah, we would. In certain situations, if it was too bad, we would refer to adult protective services in those cases.
So Jason, could you explain a bit more about what you're talking about with a private fiduciary or a public fiduciary?
Sure. I was just responding to an excellent question in the comment section where somebody was curious about what they could do if they didn't have someone that they could trust for a POA, a power of attorney. And if you truly have nobody that you can entrust that document to, that you can entrust to make decisions for you, and you're kind of at a point in your life where, and this happens, where you are alone and you don't have anybody to make these decisions for you. If the power of attorney documentation hasn't been made at that point, and it needs to be made because now, let's say you've got a diagnosis that indicates that you might have a cognitive deficit, then generally those cases get referred to public fiduciary. And that is an entirely separate program run by the state where they assign guardianship through the courts. Now, I wrote in there private fiduciary just in case there's folks that are listening in or reading in on this later. If you're not in an economic class where that would preclude you from paying for this service, then you could also pay for a private fiduciary, and they would essentially do the exact same thing that a public fiduciary does, but for a monthly fee. So that's why I wrote that in there as well. Our folks that land on our plan, generally, if you have the access insurance, then you don't have the economic means to be able to pay for a service like that. And I would say that nearly all of our folks go out to referral for public fiduciary.
And does the fiduciary, is that only like financial, or does that include healthcare decisions?
Sure. So again, this is not exactly what we do as case management, but I've got some experience in this area. So it depends on what their needs are. If they are able to manage their own finances and they're not able to make sound medical decisions, there actually are cases that are like that, then it would be specified by the court that they would have a financial guardian or a full-on guardianship where it covers both finances and medical. Again, that's a process that's hashed out through the court proceedings. A court investigator goes out to the house. The individual is assigned an attorney by the state to represent them in their interests, and all of those things get discovered through the legal proceedings.
Thank you for explaining that. I never knew what I mean, I know the word fiduciary, but I didn't know what they did. Or, and that exact, as June said, you know, if you don't have close relatives or friends, what do you do?
Yeah, and it's sad, but there are plenty of folks that that end up in that situation.
Carla.
Hi, I just want to mention that I got my I saw an estate attorney and got all the documents together a few years ago, and I'm very happy to have that all done. But I want to say, I was in my 60s when I did it, but every person in this talk, you should have paperwork already, because if you have an accident, situations can arise in which you are unprepared for if you don't have some sort of estate document. So clarification of who's legally responsible for you and what you would like to happen if something awful occurred. So I think that's huge, and I thought Jason's description of the process is very helpful. I also will mention I went to let's see, Death with Dignity classes, and that's where I met Mary Ganapal. I don't know if she remembers that, but I learned a lot from those classes, gained courage to go ahead and do what I needed to do. And I think I also, I mean, I learned a lot more than maybe I would have if I hadn't met Mary. But there's a lot of resources here in Tucson for anyone who's alone and my age, which I am, and my family all lives many states away. I wanted to have a full plan for what would happen. I'm apparently a little over the income level for Altex, I'm assuming. But I still worry a lot about how the decisions all get made if I can't make them myself. So I really appreciate this, and hope others take action. Okay, all you youngins, go get an estate plan.
Definitely.
You really need one.
I think you're right. I mean, even as a young person, I know like my husband and I, we don't have any children. And so it's like we have our durable power of attorneys, and we have, you know, because it's like you never know when something could happen, you know, and it's good to have at least something. Mary?
Hi, I've been enjoying this conversation. I have some experience in dealing with seniors and end of life issues. You know, I volunteered for a while at the Medicare Help Desk at FEMA Council on Aging, and I was always shocked to get the phone calls from people who were saying, you know, my mom gets $800 a month in Social Security, and she's going to get to a point soon where she can't live at home anymore, and we don't know what to do. And they thought that, you know, I had to always stress to them, we don't kick our seniors to the curb, you know, that there's a safety net for people. And I would turn them on to Altex and steer them in that direction. I think PCOA actually helps people fill out the applications. And you know, there was a certain amount of people that called very concerned about their relatives, and they were clearly low income, clearly qualified for something like Altex or even Medicaid. There was people who didn't even know that they qualified for Medicaid. So I got to hand it to PCOA. They've got some great, that's a really great resource for people to get to answers to questions. I also worked, I had a senior care business for a while down in Green Valley called Seniors Helping Seniors, which was non-medical care for seniors. And I hired seniors to do the work. And what always surprised me was the clients who were talking about this idea of planning for your senior years, for your last chapter. It always amazed me when I had, for example, a couple in their 90s, like 91, 92, I'm and the kids, I'm saying to their children who are really my age, in their 60s, I'm saying to them, you need to start to have a discussion with your parents about what's going to happen, where they're going to live when they can't stay at home any longer. You need to start having those discussions. And I had one, family that said, oh, we're not ready for that yet. We're not ready to have that discussion yet. And it's like, well, if you're not ready now, that's, your parents are 90, so.
If not now, when?
Exactly, yeah. And there's some really great programs to talk about end of life, to help families learn how to talk about end of life issues. And I did have my former spouse did qualify for Altex at the end of his life. He became paralyzed from cancer. And I tell you, he had the greatest care and the greatest service from his case manager here in Tucson. He lived near downtown. And once we got him into that program, which was pretty easy to do because he was obviously incapacitated. And I was very impressed with Altex and the job that they did for him. And the last thing I wanted to say, when you talk about not having close relatives for planning planning these issues, everybody has to have an advocate. Even if your relatives might not live in Arizona. There's a lot of seniors here that have relatives in other states. It's really important to have somebody that's going to advocate for you. Even people that have kids, sometimes your end of life choices might not be what they want for you. So you need to have an advocate who's going to go to the hospital with you, go to the nursing home, and make sure that your wishes are being followed. So one of the classes where I met Carla was about advocacy training. And even with my seniors down in Green Valley, I would we would have clients who had their caregiver go with them to the hospital when they went to the ER or when they went to a doctor's appointment, just to help take notes and give them the notes, because a lot of people, they might be hard of hearing, they might have early dementia, not really taking in what the doctor's saying, what the nurses are saying, what the prescriptions are all about. You got to have advocates these days, because we don't live in a society where we have these extended families with aunts and uncles and cousins and everybody living under this on the same block anymore.
Yeah.
So, thanks.
Thank you, Mary. Melissa, talking about family, what are some things that you think family can, or that you've seen be effective or not effective in dealing with these sort of issues?
I always think that when the family is the paid caregiver, it's very beneficial. I mean, everyone can't afford just to stay home and not be paid and take care of their loved one, their mom or their dad. But if we can help them to get paid and they can do that, then it's so much better for them.
Emotionally, talking about these sort of issues, how do you approach that with families and with the members that you're working with?
A lot of times the family's already doing the job, before they get to us. So, when we first get the members, we usually have the conversations with the family and the member at the same time, and just figure out what everybody wants to do.
So in helping a family member, to qualify to be a paid caregiver, does the caregiver become like an employee of, in other words, of who?
Well, we have some agencies that we contract with, different caregiving agencies in this area. It's Prilio, Arizona Consumer Direct, Lutheran Services. So what we do is we reach out to them, and then we give them the contact information for the family, and they go through pretty quick training, so that they can start getting paid right away. Or if they want a regular caregiver, then we reach out to the agency and they find us a caregiver that would be suitable for that member, and their preferences.
And then once they become a caregiver, I know one of the biggest thing with, just personal experiences I have with people is being a caregiver. I mean, it's exhausting. You need some time off,
Right.
and so getting that respite care. So then that company would then help that caregiver with providing that, needed coverage.
Yeah. Yeah. Yes, definitely. Yeah. The agencies out here are wonderful to work with too. I mean, they're quick. They get us caregivers sometimes the next day. It's always a really quick process. So we're very grateful for all the agencies in this area.
I wonder if you or Jason are aware, like I know Pima Counseling on Aging in Tucson is such a huge resource, because when you've kind of maybe been told no everywhere else, or you're overwhelmed with where to go, that's kind of your one-stop shop, they kind of know. Is there something like that in like Cochise and Greeley County?
Yeah, it's a southeast area on agency.
Okay.
So they cover this area, Cochise County. And they're a good resource too for people that haven't applied for All-Tex or hadn't gotten on All-Tex. They will send a caregiver out for so many hours a week. I believe it's like 5 hours a week, just to help out, do a load of laundry, go to an appointment with a person. So they're a great resource.
You mentioned training if you're going to be a family member.
Mm-hmm.
Do you have to be a family member, or could you be like a friend who's doing
you can be, anyone the member chooses.
Okay. And then can they do medical things, like if the person needs shots or physical therapy or anything?
No, they can't disperse meds. They basically do a little bit of housework, feeding, things like that.
Okay. So more of the living.
They go through their own training with that particular agency on that kind of thing. We also, if a doctor orders a nurse, we also contract with nurses that go out to the home as well.
So with what do you think is an image or a stereotype of a nursing home facility that people might have? Because you always hear, I don't want to go to a home. What do we not know, and what are we misinterpreting or projecting wrongly?
So I think a lot of the old stigma with nursing homes is that you only go, people think you go to a nursing home to die, but that's not really. The nursing homes have a lot to offer. They have the activities programs that they do a ton of stuff, and they keep those guys really busy. And, they go for the socialization, they have their people that they sit with at meals, and their friends, they have their roommates, and they get close to the staff. And for a person that lives at home with no family support, that's a great thing for them.
What should we be looking for if we're going to evaluate a nursing home and we're not a professional?
You can go to the Center for Medicaid and look at their last state review, their last state audit, and it'll tell you, what the things that they got dinged for, how many stars it is. So and taking a tour, I would always go take a tour and just walk around and see what they have to offer.
Is that for any facility that, like even the private homes that have like care, all of those facilities are on there?
Yep. If I had to place a parent, that's what I would do.
So when you're on that tour, what kind of, should you be looking for? Should you be looking for, are the floorboards clean? Or, are there any sort of things we should keep an eye out for to judge that as we go on?
That's what I would personally, I would look for a clean facility, and to see if the members look around, see what they're doing, if they're interacting, if they seem happy, talk to the members that are there. talk to the activity directors and see what they have going on. And that's always a good thing. Go to the kitchen and see what the food's like.
Yeah. Yeah.
Food is a huge part of people's lives, you know.
I know we have a good friend that just had to go into a home as she can no longer care for herself. And the home is, it was wonderful. We were able to go visit her. They check your temperature and whatever. And there were so many positive things, but the one thing she's been struggling with is she's very picky when it comes to food. She's very picky.
Yeah.
And so she's like, she goes, that's my prayer. She goes, just help me be content with the food, you know, but they've been accommodating, you know, like some of the things she just didn't like. And so, and it's like a private home. And so, you know, like she loves Honey Nut Cheerios. So they were like, you know, this is what we're making, or do you want your Honey Nut Cheerios? You know, which I think is, I'm like, that's great.
It is. Yeah. Yeah.
Well, we thank you so much for joining us today. It's been great to kind of find out a little bit more about what you do as a case manager, talk a little bit more about your time at the nursing home and some of the neat things that you were getting grants for, and hopefully somebody took over well for you doing that.
Yeah, the music therapy, they still do it. It's still a pretty good, successful program.
Yeah, that's amazing. How awesome to see a patient that you know, you saw on a normal day-to-day basis, you know, maybe be just not themselves, but then all of a sudden just see them come to life. How amazing that must be. And I can't imagine their families getting to see that, you know, like all of a sudden them being aware.
Right. Yeah. If you guys have not seen that movie, it's called Alive Inside. And you can also Google like the little clips of it, but the movie is just incredible. So it's very inspiring. Thank you very much for having me.
Yes, thank you. And thank Jason as well. And we thank you guys all for joining us. And next week, we actually have another guest. So next week, we have Kristen Cook. Some of you might remember her. She worked at the Star for, I think, 26 years. She had quite a few different roles. She was a reporter, but she is a hoot. Kristen is awesome. She decided to retire, I guess, in a sense. And she has authored 2 books since then, one titled This and one titled That. If you have not read them, you need to read them. They're wonderful. She has a great personality. So we look forward to having her talking a little bit more about her books and what she has coming up and whatnot. So thank you guys all for joining us, and we'll see you again next week.